Good evening, sir. My name is Sean Esorano. I'm a student nurse from DMC. And this evening, I'm going to drain your bile, your bag from your biliary duct. But first, may I please know your name, age, and address, sir.
I am Zakiti Dulapinya, 25 years old from Orienta.
Okay, Mr. Dutton, may I please see your name tag, give the proper permission. Okay, sir. So today, I'm just going to drain your bag since it's almost full, and the purpose for this is to maintain the cleanliness of your biliary your biliary bag. Is it okay with you, sir?
Okay.
So before that, I'm just going to do my hand washing and prepare all my equipment. Okay, sir?
Okay.
Okay, sir. So I'm back. I've brought all the necessary equipment for me just to drain your bag. So now I'm just going to proceed with the procedure. First, I'm just going to don my gloves. Okay, so I'm just going to inspect it first. I'm just going to inspect the bag. If there's any leakage or so there appears to be no leakage. So assuming that this bag has a port down. So what you'll need to do is make sure to open the port and empty the bag like on a container, or if you're at home, sir, you can do this. You can empty it on the toilet. So once all the liquids are removed, you need to close it again and then inspect the bag again to know if there are any holes or leakages. So it appears to be none. So I'm just going to put this back and then remove the container where the liquids are being gathered. So sir, so I'm done with the drainage procedure. So thank you for letting me do that too.
Thank you.
Do you feel anything, sir?
I'm okay.
Oh, okay, sir. So after doing the procedure, you need to do your hand washing and do aftercare and document all your findings. So now that we're done with draining, let's proceed to flushing. So in flushing, all we need is a normal saline that you need to flush on the three-way stop catheter and a syringe. So after preparing all my equipment, so assuming that I've already introduced myself to the patient knows who I am, and I've told the patient that I've done my hand washing and prepared all my equipment. So let's proceed to the procedure in flushing. So first is don your gloves. And what you need to do is, if you don't have a pre-sterile syringe that's already equipped with normal saline, you can use so assuming it is our solution, you can use this in a 5 cc syringe or a 10 cc syringe. So assuming that I'm going to drain, once the syringe is filled, you need to put this back and prepare. So sir, I'm just going to flush your bile. So assuming that this is where the air will flush, and assuming this is our stop cap. So what we need to do is to turn that off and then remove the cap, or we're going to insert the syringe. And after that, prepare alcohol swab to wipe it. Once that's done, get the syringe and then slowly lock it, but make sure it's not too tight so you won't have any, so it won't be difficult to remove. So once that's put on, you don't need to aspirate on this one. So once it's put on, you're going to slowly flush it. And once that's done, you need to turn back the stop lock, and then after turning it back, you need to remove the syringe. Dispose of that, and then lock it again with a cap. And after that, you're all done with your flushing. So very important note is that the patient should not feel any discomfort on this one. So sir, did you feel any discomfort while doing the procedure? Okay, so thank you sir for letting me perform flushing on you. Okay. So after doing that, you need to do aftercare and document all your findings and perform hand hygiene. So now that we're done with draining and flushing, let's proceed to cleaning the area and replacing the adhesive or the bandages. So for this, I'm just going to assume that I've already introduced myself to the patient. The patient has already introduced himself to me. So as usual, I've already done my hand washing and prepared all the necessary equipments here. And so after that, you need to explain to the patient what you're going to do. So sir, I'm just going to replace the gauze or the used Dragoderm on the area where your feather is located. So we should always do this every other day, or when the protective area is damaged, or you can say wet or dirty, so we can prevent infection and irritation. So first up, I need to don my gloves. So removing the bandages here may be difficult, so it's important that on your equipment you have a cotton ball that is already wet with alcohol, or you can have a prepared alcohol swab. But for this, I'm going to use a wet cotton ball. So I'm just going to slowly remove it with the cotton ball so it won't irritate the skin. I'm just going to get another one again. Remove it from this, and then we dispose of it. So after removing the used bandages here, so I'm just going to inspect the skin first for any skin irritation, or maybe there are scars or deformations. So it looks like the skin is normal. The skin area is normal here. So after I will proceed to replacing it with the new one. So for this, I'm just going to use gauze in a gauze here. So slowly lifting of the catheter, making sure the tube is also covered here. And then I'll use another one. So once you put that here, and it looks like the tube is secured. Next is what we're going to do is use a device called a trichoderm. So assuming this is our trichoderm, we need to open it and then slowly remove it, the plastic I mean. Then since this is an adhesive, we're just going to slowly place it here and lock it with the gauze. So it can be put on in one place. So there are white areas here on the trichoderm, so we need to remove that so that everything will be clear. So after doing that, after changing the old bandages on the catheter area of the patient, so after that we're going to tell the patient that the procedure is done. Sir, the procedure is done. How are you feeling?
Yeah, fine.
Okay, sir. So you're fine. And after doing the procedure, it's important to do aftercare, do hand washing, and put the patient in a comfortable position. Okay, sir. Further, may perform to do that.
Okay.
So now that we're done with draining, flushing, and then cleaning the drain. So it's important to do the last one is showering the drain. So assuming, like I said before, assuming that I've already introduced myself to the patient knows who I am, that I'm a student nurse from DMC. He already told me his information. I saw his ID tag. So sir, today I'm just going to shower with your drain. So with you. So before doing that, you need to do proper hand washing, and then prepare all my equipment. So assuming I've already done my hand washing, I got all the equipment needed here for showering, for showering the drain. So first I'm going to don my gloves. So after that, so I'm just going to ask the patient to sit up. Sir, can you sit up? So what we have here is a clear wrap. I'm going to wrap around it like the drain side.
Yeah.
So assuming that I've already wrapped the drain area, so what we're going to do now is just going to shower the patient. But I know that so that some areas here is going to go down the drain area. So it's important for us to use our hands to do as we can to block it. But if the patient has a shower head, you can control the area, where we can shower the area, so it won't be difficult for us. So assuming that I've already done showering the patient here and showering the drain, so after that you should remove the wrap, dispose of it, and then make sure that the site is dry or doesn't have any damage on the catheter or the dressing. So if it hasn't, so you should put the patient on his bed and put him in a comfortable position. So after all So after everything, and now now that we're done with taking care of our biliary area, biliary drain, so after that, we need to document all our findings, do aftercare, and most of all, do proper hand washing, and make sure that the patient is on a comfortable position. So, sir, thank you for performing all those procedures to you.
Thank you.
I'm just going to do aftercare and do my hand washing.